Hey, it's Scott. And for this week's Give Me Five, live from beautiful Las Vegas, I'm here with Carrie from Gebauer, otherwise known as the Free Spray. And during this Give Me Five, it was kind of cool because coming by the booth in the exhibit hall, I was able to learn some techniques that, even after being a nurse for over 30 years in the emergency department, I found some really neat new tricks that I hadn't come across when it came to using free spray, especially for kids.
Well, Scott, I'm glad you mentioned that. I said the biggest detriment to our product is that most people do not apply it properly. If you don't apply it properly, you might as well not use it. So I would love to demonstrate a couple tips and tricks that I've learned along the way that might be able to help you out.
Please, play away.
So Painties is a topical skin refrigerant. It is freezing cold, it is not a drug. So it is pentafluoropropane and tetrafluoroethane, which is a vapocoolant, so liquid in the can, and it works through evaporation. So I call it a fancy ice cube in a can. Only ice, can penetrate. This does not penetrate. This just sits on the epidermis and it evaporates. We have two application methods. You can either apply it directly on the skin, or you can spray it into a medicine cap, 5 mLs, either saturate a sterile 2x2 or a cotton ball, and hold it on the site for 15 seconds.
Okay.
This gives you immediate topical anesthesia for any type of needle procedure, minor open wounds, or intact oral mucous membranes.
What's the advantage? Because at least in my experience, I've seen that across the board, people tend to just take it, spray it directly onto the skin. But what caught my attention was the idea of using either the cotton ball, the sterile 2x2, putting it in a cup. I'm like, that was different. I hadn't personally come across that. What's the advantage of one versus the other?
So I would say for pediatrics or some of the elderly population, the stream can kind of scare the peds. And there's a misuse of the spray, the stream, because it kind of drips. So a lot of people don't spray long enough. So they'll actually, I'll show you that, I'll demonstrate on the ways that people do it wrong. So the ways that people do this wrong is they'll shake the can. It is self-propellant. You don't need to shake it. We see a lot of this, not effective. The way that you want to apply...
what part of what you just did was not effective? Besides the shaking part.
Okay. You want to make sure that you spray for up to 10 seconds. So the directions on our card are a little bit vague. It says 3 to 7 inches for 4 to 10 seconds. The easiest way to remember how to spray is can length away. And you want to spray along a vein. So we're going to pick one of your veins.
Okay.
I'm going to spray along your vein, and I'm going to count to 10 in my head. While I'm spraying, I usually ask the patient, "Are you feeling cold?" And they're like, "Absolutely, it's freezing."
Absolutely, yes.
I said, "Great, that means it's working. That is the mechanism of action." When I've gotten to 10, if I see a whitening occur or I've hit 10, then I would stop. Here's my fake needle. You can feel that, right, Scott?
Absolutely.
And this should feel. You will not feel the pinch of the needle, but you'll feel the pressure.
Yeah, just a little bit, but it's definitively less.
The other application, like we spoke about earlier, is you'd spray 5 mLs into a medicine cap, submerge whatever cotton you're going to be using, whether it's a sterile 2x2 or a cotton ball, and then you're going to hold it on the site for 15 seconds. So as you can see, this is a liquid, and then it works through evaporation.
That, again, got my attention because from the little kid perspective, I think that would freak them out a whole lot less.
Yes, I agree. So we do have a little chili that goes on the can, which I'm out of the little chilies, but you can also give this to your patients to let the parents know what you put on the child. The benefit to using Painties over another topical anesthetic is there's no drug in the product. So it does not require a physician's order, which is really great for the nursing staff.
Right.
And it works immediately. So the caveat is a lot of people don't spray it right. If you get the hang of how to spray it, it's a great asset to your tool bag. It is not the end-all be-all because we know that there's lots of products that you're going to need in the emergency setting.
Sure.
But this is ideal for any type of needle procedure, quick acting, something that you're going to do immediately that you don't have time to wait for another topical.
So you're saying when we chatted at the booth, you can use it for IVs and blood draws, which is what most times I've seen it done for. But you were describing people use it for immunizations, for shots.
Absolutely.
Stuff of that sort as well. That's something I personally haven't come across, but I'm like, oh, that's kind of cool because giving a shot is certainly not pleasant.
Right. And it's
so if we can make it easier, and this is nearly instantaneous,
correct.
That's totally cool.
So the biggest problem with the product is that nobody sprays it right. If you can remember, can length away, and we're going to count to 10. If we see a whitening occur before you get to 10, then you would stop. Okay. That is the easiest way to remember, or the cotton application, which again, like you said, is probably better for the pediatric realm.
So when in doubt, chill out and give it a try.
That's right.
Bonus. Thanks
Hey,
again for your help.
thank
Appreciate
you.
it. Thanks so much.